Hi everyone, I'm Chavi. Welcome back to my channel. In today's video, I have a very different topic for you today. So today's topic is related to healthcare law. So in today's video, we'll start with the national perspective of healthcare law in India, and also we'll study the historical perspective of healthcare law. So before actually jumping into what is healthcare law, what are the laws which we have in our country India, first question which I want to ask for all of you is, do you know the difference between health and healthcare? Is there any difference between the two terms, that is health and healthcare? So there is. When we talk about health, health is a complete social, physical and emotional well-being of an individual. This definition is according to WHO, that is World Health Organization. So when we talk about health, health is a complete social, mental and physical well-being of an individual. But on the other hand, when we talk about healthcare, healthcare is a system or an industry through which people provide medical care to the people in need. So basically, healthcare is a system or an industry through which people provide medical care to the patients. Now the question comes, what is healthcare law? So healthcare law is something which we'll start today. So healthcare law basically are the laws which deals with the relationship between those who provide medical facilities and to those who receive those medical facilities. In simpler terms, so basically when we talk about what is healthcare law is a relationship between all the persons who are providing medical facilities. For example, all the medical professionals, all the staff which are there in the medical industry. For example, doctors, nurses, and everybody. And on the other hand, the second party is the patients who receive medical care. So this was the definition. This was the difference between health and healthcare, and now you also got the definition of healthcare law. So let's begin. Okay, now moving on to the historical perspective. So before discussing historical perspective, please keep in mind that whenever we are talking about the definition of health according to WHO, that is World Health Organization, keep this in mind that the definition of WHO, which talks about health, talks about three aspects. The first one is physical, the second one is mental, and the third one is social well-being. So these are the three aspects which comes under the definition of health. Now please keep in mind that now the definition of health is not only about the absence of disease or infirmity. Initially, in earlier time, it was that, in the previous time, it was considered that health is only the absence of disease or infirmity. But now the definition is more refined version of the earlier one. Now the definition is that the health means that is complete physical, mental and social well-being of an individual, and not merely the absence of disease or infirmity. So this was the definition of health. So you can see that how the definition of health has been changed over the period of time, how the definition of health has evolved over the period of time. Like initially it was only mere the absence of disease or infirmity, but now it is more refined and more evolved version of definition of health. So we talked about health, we talked about healthcare, what is the definition of healthcare. We also talked about healthcare law. Now when we start with ancient era, so we'll see that the first one was the Harappan civilization. So when we talk about Harappan civilization, this is one of the earliest civilizations in the recorded history which talks about health. So when we'll have a look on these civilizations, we can see that the people of these civilizations were having health as a very important factor in their life. So when we'll flip the pages of history, we can see that how people of these civilizations were having very much interest in healthcare, and they have kept a health part or a health factor a very prime important part in their life. So this was all about Harappan civilization. When we'll move further, we can see that in the Indus Valley civilizations, we can see that we can trace that there was a remnants of planned cities, and there were perfect drainage system, and we can see that there was also plans which are conducted for environment sanitations. So from all these things, we can see that the people of these civilizations in the ancient era were having very much importance in their mind regarding the health care system. Now when we move to Vedic period was the period which was mainly dominated by the Jainism and the Buddhism. We can see that the Ayurveda was introduced there, which was very important factor when we talk about healthcare systems and when we talk about the health of individual. Now this was about Vedic period. Now when we move further, when we talk about King Ashoka's reign, so keep this in mind that this King Ashoka's reign was the first was very important. Why? Because it is in this reign that for the first time the hospitals were introduced. So hospitals were first introduced in King Ashoka's reign, and hygiene was given prime importance at that time. And then when we move to Mughal's reign, so in Mughal reign the that Ayurvedic system was declined, but new system was introduced that was known as Unani system. Plants and herbs were given prime importance in that period. So when we'll have a look on all these factors, when we'll have a look on all these historical perspectives, that is when we have a look on ancient era, then Vedic period, and then Ashoka's reign, and then Mughal's reign, we can see that the health has been a very important part in every reign and in every period, whether it's ancient, medieval, or even now. We talk about British era. So British era, in that time they have introduced the concept of modern medicine. So they have also introduced various acts regarding healthcare laws. So when we talk about British era gave us the concept of modern medicine. So various hospitals were constructed at that time also, and various laws were also constructed were made at that time regarding health of the individual. Now when we'll talk about post-independence era. So when we talk about post-independence era, when do we get independence? Do you know the year? Okay, so in 1947 our country got independence. So our country, India, witnessed for the first time the concept of, what's this? Welfare state. So the concept of welfare state was introduced for the first time in India. So this was a very remarkable step which was taken, because the whole burden of health department was on the national government. So that's why this concept of welfare state was introduced. Now then there was a Bohr committee. Okay, so Bohr committee was of the year 1943. Okay, so 1943 this committee was of a pre-independent era. So this Bohr committee was of a pre-independent era. So lekin after post-independence we have taken various ideas from this committee. Then came the Planning Commission. Okay, so Planning Commission was of 1950. Okay, so before 1950, in 1947, various health ministries were constructed in center and state. And then later on, when we talk about 1948, in 1948, our country India became the member state in WHO. Now what is WHO? I know you all know it. What is it? WHO is World Health Organization. So in 1948 our country India became the member state in WHO, that is World Health Organization. And then in Planning Commission was of 1950. So when we talk about Planning Commission was the commission which introduced the drafting of 5-year plans which were focused on improving the health of individual, improving the public health of our country. So when we talk about Planning Commission, there were the 5-year plans which were constructed. So the aim of these plans were to improve the health system of our country. So when we talk about Planning Commission, and then when we'll move further, you will see the transition, you will see the evolution. What you will see, that when we when there was a time of Planning Commission, our main focus was on the absence of disease. The prevention of disease was our main focus. But when we'll move forward, okay, I'll tell it later. Please remember, till now in Planning Commission, our main focus was in the prevention of disease. Okay, so in 1950 there were Planning Commission's 5-year plans were drafted. Then it was the 12th 5-year plan, which was the last 5-year plan. So this was in the year 2012 and 17. So this was the last 12 5-year plan. Later on, this Planning Commission was replaced by Niti Aayog. So Niti Aayog came, then Niti Aayog introduced the concept of 3-year plans. So initially it was 5-year plans, now it is 3-year plans. So what is there in 3-year plans? So in 3-year plans, it was the main focus was that these 3-year plans turned out to be more efficient, and there were various new approaches which were taken in these 3-year plans. For example, the state who will achieve that target will get the incentives, whatever maybe the target of those plans. If any state would achieve, then they'll get the incentive. So this was regarding the 3-year plans. So keep this in mind. Planning Commission 1950, and then the last 5-year plan was of 12th 5-year plan, which was in the year 2012 and 17, and then later on Niti Aayog came, which replaced Planning Commission. So this was about independence era. Okay, now we have National Policy of 2017, where key features are there of that policy. I'll tell you the key features of that policy. Okay, please keep this in mind, like what I told you at this point of discussion. In planning, when we were discussing Planning Commission, I told you that our main focus was on what? Prevention of disease. But now when this Planning Commission came and all these things came, our focus has shifted. How our focus has shifted? Like initially it was sick care, those who are sick, they would be treated. Okay, the focus was on prevention of disease. Now how focus has shifted? Because now the focus is on the promotion of health. Like, please keep this in mind that initially the focus was prevention of disease. Now the focus is on promotion of health. The promotion of health, like our Gandhiji also said that it is health which is the real wealth and not the pieces of gold and silver. So this is this health which we all have, this is very precious. Please keep this in mind. Like this is the only property which is very essential for all of us. This is the only property for which we are doing all these things. Like we are going for job, we are doing so many things. So this is just because of this health. So keep this in mind that it is the health which is the real wealth and not the pieces of gold and silver. So now I told about national policy. When national policy of 2017 came, various new initiatives are there. Like I told you that now the focus is on promotion of health, and then various new changes are there, like our honorable Prime Minister's initiative of Make in India is also there to promote that Make in India project. So, and also to promote public health at large, and also to reach the target reaching the target of investing 2.5% of GDP in public health sector. So all these are the key features of national policy of 2017. I hope this concept is clear. This how I told you, like how I explained regarding the focus on health from ancient to this present time. Like from this we can see that this health is very important, and this health has always remained the prime focus in every era, whether it's ancient, medieval, or this present time. So I hope this concept is clear. I hope you can easily trace that how this concept of health has been traced. This concept of health has evolved from over time. Okay, so with this we are at the end of this video. I hope you all are fit and fine. Please do yoga, meditation, do exercise, stay healthy, stay fit. Thank you so much. Bye bye.